Good afternoon, and welcome to the OC Forum's The Future Of program series. My name is Kate Klimo, and I have the privilege to serve as the new president of OC Forum. During our 30th anniversary year, our plan was to invite leaders and visionaries to share their insights into the future. Then COVID changed the future overnight. Without hesitation, the OC Forum offered our first virtual program on Orange County's response to the coronavirus that reached thousands of viewers who were hungry for information. From then on, the OC Forum board worked tirelessly in serving up virtual programs focusing on the future of the economy, mental health, race relations, transportation, education, esports, affirmative action, philanthropy, and even Orange County itself. Perhaps more than ever, we are reminded of the importance of OC Forum's mission to host civil conversations and propose solutions around complex issues that affect us all. Today, we will introduce you to several visionaries who are shaping the future for people in the county and worldwide. As a nonprofit that has historically relied on contributions from in-person events to help fund its mission, the OC Forum has seen people and institutions in this county step up and offer their support through sponsorship. I would also argue that our amazing and diverse board of directors are among the most engaged on the planet. Now we would simply not be able to carry forth the mission of OC Forum without your contributions. Thank you. To all of our viewers, supporters, and sponsors. While we face one hurdle, roadblock, and pile of lemons after another, we have not forgotten to celebrate each other. We hope you enjoy today's program as we continue to celebrate the 30th anniversary of your OC Forum. Thank you for tuning in, and enjoy the conversation.
Good afternoon. I am Steve Goldstein, Vice Chancellor of UCI Health Affairs, and it is my pleasure to serve as your moderator for today's virtual OC Forum on the future of the Delta variant with our two expert panels. Our first segment is on the topic of the ongoing Delta variant surge, and our second segment will focus on public education. I want to start by thanking the team at the OC Forum for hosting this event. UCI is very proud to be a sponsor. So let's jump in with a few facts. The SARS-CoV-2 pandemic has revealed remarkable resilience and strength across the country. With breakneck speed, biopharma developed vaccines. Hospitals and providers have been creative and indefatigable in providing services. Telemedicine has been liberated to care for patients at a distance, and businesses have adapted to run while protecting their employees and customers. Public health organizations have flexed to address an onslaught of need. But the stress has also revealed weaknesses. The pandemic has shown limits of our fragmented American healthcare system that make it hard to offer broad, high-quality care to all. And brought into extremely sharp focus has been the damage of health inequities in all parts of our nation. This is a natural experiment described as from a scientific viewpoint, and it's demonstrated principles of epidemiology would have been far better not to prove again. And that brings us to today's topic, the Delta variant. Partial herd immunity creates evolutionary pressure that leads to more successful infective viral variants. They emerge and then they dominate. The Delta first emerged in India in December. It swept through India and Great Britain before reaching the US, where it is now the predominant variant. The Delta is more transmissible than the common cold and influenza. The highest number of cases and severe outcomes are in places with low vaccination rates, and virtually all hospitalizations and deaths are among the unvaccinated. Thus, people who are fully vaccinated continue to have strong protection against hospitalization and death. However, vaccinated people can transmit the Delta. Therefore, those who are unvaccinated and not practicing preventive strategies are at very high risk for infection. Today, our panels of experts representing the Orange County Healthcare Agency and diverse teams in health, research, and education across UCI are here to answer your questions, alleviate some concerns, I hope, and help direct you to resources to help your businesses, communities, and families. So for the first panel, we have Dr. Shruti Gohil, Assistant Professor in the Division of Infectious Diseases at UCI School of Medicine and Associate Medical Director of Epidemiology and Infection Protection of UCI Health. She is a leading health system. She is leading our health system response to the pandemic. This includes clinical and epidemiologic assessment of healthcare worker and patient management, COVID testing, exposure definition and response, contact tracing, infection prevention strategies to limit spread, and vaccination. And in her spare time, Dean Boden-Albala is our director of the UCI program in public health and founding dean of the Planned School of Population and Public Health. She has been at the forefront of Orange County's public health response to COVID-19, working with the Orange County Healthcare Agency and state officials to help assess the pandemic and implement mitigation strategies. So she will be here to discuss the Delta situation from a public health perspective. And then Dr. Regina Chincio-Kwan, or Dr. CK, Deputy Health Officer of the Orange County Healthcare Agency. She obtained her medical degree from Western University and completed her residency in family medicine at the Naval Hospital at Camp Pendleton. Dr. CK has crafted responses to address health disparities, communicable disease control, and population health management. And she's developed a public health infrastructure to promote well-being and implement preventative interventions. So she has brought public health innovations to scale. Let's jump in now with the experts. Let me start by turning to Dean Bernadette Boden-Albala. Based on your public health background, what is the current risk level of the Delta variant here in Orange County?
Thanks, Steve. And I think we all feel like we're living the title of a Beatles song, The Long and Winding Road. Just hang in there, everyone. Over the last couple of weeks, after having, I think, a relatively low-risk summer, we've seen this increase in number of cases, about 600 to 700 cases now a day we're seeing here in Orange County, which equates to about 137 cases per 100,000. That puts us at high risk. And 98% of the cases in California, as we're seeing here, are the Delta variant. So it's really time to be vigilant and to be vaccinated.
Okay, Dr. Gohil, as an expert in infection prevention, is the Delta variant more dangerous than the previous strain of COVID-19 that was so prevalent?
Yeah, we're so lucky in some ways because we do have a mostly vaccinated population, so that blunts the way that we might detect how severe this virus really is. But there is growing evidence that indeed this virus is more severe. I just came off of the wards myself, the infectious disease wards, and I was struck by saying that many around the nation have said, as physicians on the front line, which is people seem to be getting sicker, quicker, and longer. And that is something that's substantiated in early data in Scotland and other places that have seen Delta virus. In particular, there's a study that just came out, actually a basic science study in Nature that came out that showed that the mutation that occurred to elevate Delta to this hyperinfectious strain. That mutation not only is a single point mutation, so very humbling, but that's exactly what happens with influenza and other infectious disease. But that single point mutation not only increases the transmissibility risk, but to your question about severity of illness, a study has been able to show that the virus can knock on the door of cells of its neighboring respiratory cells quicker and faster with more efficiency. So that would go along with the severity of the strain as well.
Okay. Dr. CK, as Deputy Health Officer, what are the latest regulatory measures in place to try and help us in Orange County?
Most of the regulations you're actually seeing from the state are really to promote vaccination. We already know that the healthcare workers really need to keep themselves healthy because they're the ones taking care of the sick. And so everyone who's not yet vaccinated needs to get vaccinated. That's what we saw in the public health orders that came out July 26th, where they looked at, hey, all these facilities, healthcare facilities, congregate settings, really need to, one, verify if you are vaccinated that you are vaccinated. If you're not vaccinated, everybody needs to wear a mask and be more mindful and careful. But that being said, almost immediately we saw the order come in August 5th that now we had specific healthcare workers that needed to be vaccinated, show proof of it, and be fully vaccinated by September 30th. And then from then you saw the recommendations for schools, universal masking in the schools to prevent the transmission. And that's for students as well as staff and everybody on that setting to protect all the unvaccinated students. And then more recently, an order was placed for the congregate, and for the correctional facilities. We know that this is more of a congregate setting, that's a vulnerable population. So there is now a vaccine requirement for the staff in that setting. And more recently, August 20th, Dr. Chow did put a health officer order for Orange County, really just summarizing all the health orders from the state, but also strongly recommending that those paramedics, EMTs, and those who are visiting homes and taking care of patients also try to abide by the recommendation to get fully vaccinated by September 30th.
Okay. Dr. Gohil, how common are breakthrough cases among vaccinated people? And maybe as you comment on that, you can shed some light on all of the noise we're hearing about boosters.
Yeah, so data are emerging, of course, as to what breakthrough looks like. So there are two things embedded in your question. On the one hand, there's this idea of vaccinated individuals acquiring illness, and then vaccinated individuals becoming so sick that they require hospitalization. So those two things should be addressed. And so there was a Kaiser Family Foundation study that was done as a report at the end of July. So it included some of the Delta variants going through southeast part of our nation. And if they look across those 24 states, the infections amongst vaccinated individuals were estimated to range between 0.2% and 5.9%. So if we accept that the initial clinical trial data from the mRNA vaccine, for example, is 96%, 94 to 96% efficacy, we're sitting in that range in terms of who's acquiring illnesses within the vaccinated population. But I am humbled by Delta. We'll have to see how this pans out. The data are being actively evaluated, including through the UC, and I think more data are to emerge as to what the breakthrough rates actually look like in the setting of a full Delta surge. Okay, so acquiring illness. How about those who are vaccinated who then go on to develop, who acquire the illness? How sick are you going to get? As of August 16th, the CDC identified 9,700 some odd patients who have had vaccination, breakthrough infection, and who were hospitalized or died amongst 168 million people vaccinated. So that's an event rate of 58 per million. So that's pretty low. That's pretty good for preventing the vast majority of people who are getting severely ill to get hospitalized. Again, underscoring your comments, Dr. Goldstein, when you opened, the vast majority of those who are unvaccinated.
Okay. I'm going to come back to the question of boosters, but first I'd like to remind the audience, and I should have said this at the outset, we would really like to be able to answer your questions. So if you put questions in the comments, they'll come forward and I'll be able to pose them to the expert panel. So please don't be shy about asking what's on your mind. So back to the boosters. Everybody wants to know, should they get a booster if they've already had 2 shots? And then there are rumors that there will be not just a 3rd shot, but a new booster coming out that actually is for the new variant. And then we hear that, wait a minute, if you get it, you need to wait 4 weeks before you get your flu shot. So how are we going to do all of this? And what are you thinking about?
Oh, it's, I think that's directed to me. Is that right?
Yes, please.
Yes. Okay. Yeah, absolutely. Top of mind for all of us. In fact, that is one of the things that is really taking up a lot of our time here at UC Irvine in our health department here. So the whole game is about how many soldiers do you have ready to fight if you're confronted with the virus? That's the bottom line, right? That's it. That's what we want. So if you get enough virus particles in your nose or your mouth, and you can outnumber whatever soldiers you had ready at the ready to fight, then you're going to override your vaccine immunity that you may have. So the most common scenario that we're seeing that in is those people with close contact, infectious persons, etc. So that said, if you accept that that's the way we override our immunity, then you can see that getting more vaccine and antibodies through vaccine would be a good thing. And so the calculation is made, even though we don't have a Delta-directed vaccine at this moment, the calculation made at the public health level is, hey, let's get those soldiers up. The boosters I anticipate right now, where of course we are immunocompromised individuals have been, recommended to go ahead and get their boosters, sure. But we fully anticipate that anybody who is 6 months to 8 months out from their initial 2-dose series is going to be eligible for the boosters, and that is being actively looked at through ACIP and other bodies. Yep.
And I hear now that we're allowed to mix and match if we need to. You can get a Moderna if you had Pfizer. You can get a Pfizer if you had J&J, because anything that makes the soldiers stand up is a good thing. Yeah,
I think this is what we're hearing as well. I haven't seen definitive data on that. However, okay. Absolutely, that is the thinking, the mixing and matching between them all. Maybe you'll get a good
Although mix. What I understand is if you've tolerated one already, it's better to stick with it. If you've had Pfizer, stick with Pfizer.
That's right. That's exactly right. That it's UCI Health for now. Our recommendation is going to be to continue with the Pfizer series.
Dean Boden-Albala, given your studies of Orange County and your work with state officials, what preventative measures should our community be taking now with the Delta emerging with this new 4th surge?
What surge? I know. Look, we are where we are right now. We are at a place where I think we're seeing there's some evidence, and it's, as Dr. Gohil said, it's all just emerging now, all this evidence that there is some waning immunity from the initial vaccines. And we have this very highly transmissible Delta variant. So it used to be that we thought about a scenario, right? If you were in a whole uninfected group and you were infected, maybe 2 people, you would infect 2 people. Now we're talking about you being able to infect upwards of 4, 6, or 8 people. That is a lot more people, and each of those would infect 6, 8 people, and you can see how that is much larger and quicker. So we have that, and then on June 15th, all masks were off, and so these 3 things converged together. And of course, it's been hard. 18 months of shelter in place and mask wearing. People want to be free. I want to be free. I hate masks too, but Now, again, as I said before, vaccinate and vigilance. This is really the time. We have a whole population that we're going to hear from in our second panel of totally unvaccinated people, our children. And we have people that are immunocompromised who may not have the good immunity that the vaccine confers to healthy individuals. And we have this waning. So what do I say? I say, just like the CDC says, inside, you've got a mask, and you've got to mask properly. No bandanas. Really use the good masks if you're going to be in large crowds, which I would say stay away from at this point with our high risk level. You know, there's some suggestion that maybe you double mask and make some decisions. I've said this all along. Go to the supermarket, wear a mask. I was at the supermarket the other day. Nobody was wearing masks but me and the folks that worked there. Go at times that lots of people aren't there. Keep your distance still. I think that's the right thing. And always choose outdoor versus indoor. There'll be plenty of time for indoor, and still stay within some of those bubbles. You know, maybe not the time to go out and embrace everybody at a major music venue. So those would be my recommendations. Still hand wash. I'm just gonna laugh and say, what happened to all of those great people that were washing the carts in the supermarket? Somehow that's ended. So be careful, be vigilant. And if you're not vaccinated, get vaccinated. If you know someone that's not vaccinated, please convince them to get vaccinated. It's really important.
So if I combine the last few questions together in a statement, would it be fair to say that if you're vaccinated, you are likely not to be hospitalized with Delta,
right,
or die from Delta?
Right.
But you can carry the Delta and transmit it to the large number of people still in the nation who are not vaccinated, like our children and the immunocompromised and those who can't take it. So a lot of these activities are to protect everyone else.
Yes, and you know, as Dr. Gohil has said, and Dr. CK, there is breakthrough. It is real. It varies from no symptoms, I didn't even know, to significant symptoms. And again, the more significant, critically ill, really associated with other underlying conditions, and really very, very small. What we don't really have a good sense of is what that forward transmission is. If I'm vaccinated and have minimal to no symptoms, can I transmit? And what the data, and again, Dr. CK and Dr. Gohil can add to this, but what the data suggests right now is that I probably have a shorter period of transmission, but that I can indeed transmit. That's correct.
Do the other panelists agree with that transmission data?
Yes, correct. And probably Dr. Gohil has more information about this, but there were studies looking at the viral loads of unvaccinated and vaccinated who actually carried COVID, and they did see that the viral loads were similar when previous studies with previous variants showed that the vaccinated had lower particles or viral load in their nasal passages. So Delta is just different. And so we all have to be mindful, even if you're vaccinated, you do need to take all the precaution you can.
Okay. So a question from the audience, and I don't want to get Dr. CK in trouble by having a political conversation here, but the question that's come forward is, why hasn't Orange County mandated mask usage indoors like LA County?
I think, you know, we want to make sure that we got the message out that the one thing that everybody needs to do is get vaccinated. So we didn't want to distract from that message. You know, once you start mandating things, a lot of people get concerned about the freedoms that are supposedly taken away. So it really distracts from the message that we all need to keep first and foremost in front of us. So again, we were just trying to make sure everybody can listen to that message, get vaccinated. Now, that being said, you know, mandate versus no mandate. The other thing is that people want to feel empowered and get the information, hopefully hear from these type of webinars and make decisions for themselves. And I get it, we're in America, we all have freedoms, but when we start encroaching on others' safety, that becomes an issue. And we're hoping that we live in Orange County. We have very smart people who live here. And we want everybody to make that decision for themselves. And I know it's a very political issue. And do I wish? I mean, I'm a very anxious person, if anyone knows me. And if I could mandate anything, I would, because I come from the military and that's my background. But at the same time, when you do that, you distract. And sometimes you may not get what you want, right? When you actually may move further when you empower everyone else. And so I think, that's what the stance that we're taking. And again, and it's working. I think we have a lot of people who are getting vaccinated, and a lot of people are still being free, and also taking precaution. I think the majority here in Orange County is actually listening. And we saw that with previous studies and surveys with Chapman University and other studies.
Nicely handled. Bernadette?
Can I just add one thing, which is when we make community health our priority, okay? And that means masking as one thing, and vaccination as something else also. We make our health our priority, our kids' health, our parents' health, and everybody out there that we know, we don't know. And it's a win-win when we do that.
Dr. Gohil, I have a question from the audience. Is there a chance of reinfection if you have already had COVID-19? And how do those patients fare if they continue to be unvaccinated?
Now, the second part of that question, I don't have firsthand information or data for. The first part, absolutely. Can you get a recurrent COVID infection? Absolutely, you can. We have seen it throughout the health enterprise. In fact, there are some people, very rare, but there are some people who have gotten it as much as 3 or 4 times over and over again.
Wow. So
you can get it recurrently. And that's not surprising if you think about the cold virus, actually. Season to season, sometimes you can get the same darn cold virus over and over. So we're not surprised at all.
Okay. Another question that's come up that I think I'll address to you is, should we get a flu vaccine before we get a booster for COVID, or at all?
Definitely will be recommending flu vaccine for everybody in the community. The last thing we need is 2 circulating strains of something that can do something bad to you. Absolutely. So that's no question. The other part, can you do it before the COVID booster? I think you should think about the timeline of which one is more urgent. So for example, if you were only recently vaccinated against COVID, somehow you got your 2 series later in the year or something, you'd probably have some protection on board, then you would prioritize the flu vaccine when it's available, or vice versa.
Okay, thank you.
I'd like to add a comment on that.
Oh, please.
Just to give some color to viruses in general, we're already seeing RSV pick up here. So that's another virus that's in town that has a vaccine. And so if we're already seeing that, I wouldn't be surprised if we see flu. And this is where it becomes very important to also consider getting your flu vaccine. Give it a little bit of time so that your immune system can get the antibodies ready for both viruses.
So, Dr. CK, let me continue with you. A question of, how is your team working to try and provide equitable vaccine distribution for those most at risk in Orange County?
So we have partnered and had ongoing conversations with our community-based organizations. We have a vaccine task force that has a lot of different people who are actually on this call who are also on that task force. And we've been meeting since, I believe it was September, October, before I even joined the organization. And again, it's a community effort. We cannot do this alone. We have a dashboard. Before our dashboard was even created, when we started getting vaccines out, we partnered with Patient or Othene, better known as Othena. And the reason is we could actually see zip codes of where people are getting vaccinated. And so immediately from the get-go, we were able to immediately track which areas we're getting vaccinated, where we needed to focus. We have a dashboard now with our vaccine task force looking at what are the high hotspots in Orange County that need vaccine. So those top 10 cities, their zip codes, are actually targeted for mobile pod efforts or events. We also have been talking with CalOptima, and you may have known a lot of CalOptima members have received a lot of information about incentives. We also had mobile pods specifically for that group. And so far they're doing very well. I think, you know, it takes a village to really get everybody vaccinated. It's not just Orange County alone. I think healthcare agency, it's the community, it's UCI, Hoag, Providence, Memorial Care, everybody coming to the table to get people vaccinated.
And that ties into a question that I think I know the answer to, which is, will mass vaccination sites be set up again for the boosters? My understanding is that now that there's a plentiful supply of vaccines and pharmacies are engaged, we are unlikely to set those giant mega sites up again. Is that true?
We are assessing and we are making sure that all the primary care providers who want to have a vaccine administered that feel supported. We have lots of pharmacies, healthcare systems who you know, are offering vaccine, but we'll be monitoring that very closely. We're not the only county having to handle this situation. And just as a reminder, we also have the vaccine engagement, equity engagement program. So anyone honestly can ask for a mobile clinic to come to them and get vaccinated.
Excellent. Question. If I am fully vaccinated and I go to the home of someone, a client, for example, who is also vaccinated, should we all wear masks? Anyone can jump in.
I think, oh, Dr. Gohil?
So go ahead, Bernadette.
I say yes. I say that we are in a high risk situation, that there is breakthrough. If it's somebody that you're not really intimately living with all the time, I think we're back to masks inside. Outside distancing, you can take your mask off, but that's what I would suggest.
There's a question here that I don't know the answer to, and I don't know, Dr. Gohil, if you will know it. If I got 2 shots at UCI, will UCI invite me for my booster?
That's you know, it's as Regina mentioned, yeah, it is being considered actively. Is the answer to that question? Yes, the hope is absolutely that we will be rolling that out.
So through the My Health app, people might be told it's been 6 months, you're eligible.
That is the hope. That is absolutely the hope. We have yet to operationalize exactly how we're going to approach it, but that is the hope.
Here's another question. How would you boost morale and the promotion of vaccines when there are articles that report that the vaccine is only 66% effective against the Delta variant?
Yeah, I mean, that's right. So, you know, it would be great if these vaccines were 100% effective, and it's always the goal. This vaccine was very effective against our original COVID, but we didn't get everybody vaccinated in time, and so we ended up with these variants. And so now we're in a very different situation. But the one thing that we do know is that this vaccine significantly reduces your risk of death and serious illness. And, you know, hopefully some long COVID, some long COVID disability that we're just starting to understand. Look, there's only 2 options out there. As Matt, as my friend Matt, his name I'm blanking on now, from Orange County Healthcare Agency, talks about, you either are gonna get vaccinated or you're gonna get COVID. I mean, that's how transmissible Delta is. And so we really do need to focus on getting everybody vaccinated.
Right. The last data that I saw from the state of California was that 98% of those who are hospitalized and 99% of those who have died are unvaccinated. That would be my argument, that you should vaccinate. It is important.
That's exactly. Well, I didn't mean to cut you off, and I absolutely agree with that. I just want to add that somehow our public, we've gone through this pandemic kind of with an exactoscope from our communities, which is a good thing because now we've raised the overall awareness of, infectious disease. But year on year, we deal with influenza, and year on year, we deal with a vaccine that it has an efficacy ranging from 25 to 60%. And we're wildly successful at mitigating disease every year outside of a pandemic year, a flu pandemic year. But we're pretty darn good at protecting the public. And so people forget about all this. It's just that the vaccine uptake in influenza has been difficult. And so you still see the untoward consequences in death and hospitalization. We don't want to go there with this pandemic. The second thing that I would tell people about the vaccine and why they should accept it even at a lower efficacy is that the more transmission pathways you leave open. So we're now at Delta. We were Alpha, then we're Beta, and a couple of other strains. We're Delta. But guess what? They're around the corner. This is going to get self-selected, just as you said, Dr. Goldstein, in the beginning, which is it's going to self-select to a more virulent or more dangerous strain. Who knows? And so we need to cut those transmission pathways.
Excellent. All right. So I'm going to turn to a different type of question for a second. I'll direct it first to Bernadette. What is one myth that you'd like to debunk that you see floating around in the social network?
Oh, there are so many myths. There are so many myths. It's interesting because even the myth of reproductive issues. I had a conversation the other day with somebody who lost 5 members of her family to COVID, and her child just turned 12. And I said, when are you scheduling the vaccine? I'm worried about reproductive issues. And I think, the same misinformation was floating around for polio vaccine. This reproductive issue misinformation, it scares people. It's the piece of misinformation that people just like to grab because, right? It's like, it's not just now, it's about the future. Debunk it. This is a messenger RNA. These are messenger RNA vaccines. This has nothing to do with reproduction. Debunk that.
Dr. CK, do you have a favorite myth you would like to debunk?
Actually, I have several, but one of the myths I keep hearing is that, I've already had COVID. I don't need this vaccine to protect me against the Delta variant. My natural immunity is going to be stronger than that vaccine. And unfortunately, what we are seeing is that it doesn't matter what other variant you've had. If you were sick in February, March, people are getting sick again with Delta, and the symptoms are more severe. So the best thing that everyone can do, whether you had COVID or not, is use the vaccines to get that immunity, even if it's 60%, 66%, because it will save you from death. The other number I want to put out there is, looking at our data here in Orange County, because I know that's what matters right now, 41 deaths since June 1st here in our county, all could have been preventable. All 41 deaths were not vaccinated. Only one of the 41 received one Moderna. Everybody else received no vaccine. So those are 41 people who could have hopefully, survived had they been gotten the vaccine.
I have one last question from the audience. Two that have come up. One is, I wonder if a mask, along with providing COVID protection, is keeping out germs that I may need for a healthy immune system. Dr. Gohil.
Yeah, you're talking to somebody who's trained both in infectious disease and has some background in immunology. So I respect the nature of that question. I get that. Right now we're in a pandemic, would be my answer to that, is that right now is a time when we are cutting transmission pathways, number one. The second is that absolutely not. I mean, the severity of illness here, you don't know if you're going to be one of those people who end up in the hospital in a severe case. What this has done to lungs, I mean, it's incredible. If you took a CAT scan of people's lungs who are sick and hospitalized, this doesn't even count those people who are sitting at home quite sick. We don't do CAT scans on that, right? And this idea of long COVID that Bernadette was talking about. But boy, if I showed you one picture of those CAT scans, if anybody wants to go do that, go onto Google and go ahead and get an image of a COVID lung on a CAT scan. You will see what I mean when we're facing that and the patient's in front of us, and we've got that much percentage of lung affected. We are humbled. And I would say absolutely, this is not a time to build up your immune system. Build it up with the vaccine. That'll do the trick.
Reminds me of when we put warnings on cigarette packages that were at least supposed to bring things to mind. Those CAT scans are terrifying of the lungs. Bernadette, to achieve herd immunity, what percentage of the population needs to be vaccinated?
The number keeps going up. It's interesting. The conversation we started with, we were talking about herd immunity at about 70%. We're really now talking about 90 to 95%, which is really consistent with the herd immunity numbers that are out there for all the other infectious diseases where we've been able to achieve herd immunity through vaccination. I just want to add one other thing to that. We're never really going to be able to get herd immunity until we get our children vaccinated. And don't forget, in Orange County, I think there's 700,000 children out of 3.2 million residents of the county. That's almost, is that right? Almost, Dan's looking it up, almost a third. So we can't expect to achieve that until we get that other population taken care of as well.
All right, I'm going to bring in an expert from the next panel, unbidden, Dr. Dan Cooper, who I will introduce later, to ask a question. Now that the Pfizer is approved and doctors can do off-label prescription, what about my 9-year-old who I'd really like to protect?
I will put my hat on as a pediatrician in this case.
Yes.
And as an investigator, we need to wait for the safety and efficacy studies in the younger children. As much as I think from the rumors I hear that they're good and they're positive, I don't think it's ethical at this point to do an off-label immunization. We're going to hear about this soon enough. Thank God the children are not getting particularly ill. Now, I don't mean to diminish the fact that some kids are, and there are kids at Chalk Hospital right now, a couple in the ICU, but I would not recommend an off-label immunization. I mean, I'd love to hear from the other panelists as well.
I could say that every provider who signed up to administer the vaccine actually signed a way to say they are going to follow the recommendations that the CDC put forth for these EUA authorized vaccines. So there is no off-label right now. And technically, yes, if someone is under the age of 12, the dose already is going to be different. So you don't want to even lie about your child's age to just get that adult dose. You really want to wait until it's been authorized for that age group.
Okay, well, I want to thank the panel. You are truly experts and smart and delightful, and it is an honor for me to work with you. For the audience, we're going to take a short commercial break before the second panel. I think that will begin.
At UCI, we believe in the infinitely curious. We believe in the courageous of thought, the ones willing to fail again and again until one day they don't. When you have the courage to see things differently, to see opportunity where others see impossibility, amazing things will happen. At UCI, we stop at nothing to change the world, to save lives and deliver the extraordinary.
In honor of our 30th anniversary celebration of the OC Forum, we are raising $30,000 to establish an endowment fund. Our 30 for 30 fundraising campaign is looking for 30 generous sponsors to donate or pledge $1,000 to this fund. If you wish to contribute, please visit the link in the description below this video. I would also like to thank you for your continued support. These programs would simply not be possible without your contribution. Now please enjoy the rest of the show.
Welcome back. We had a very good first segment, I thought, and now our second will be on public education. Now that we are embarking on back to school season across the country, many people have concerns, parents, teachers, and students. So we have a stellar lineup for our second panel. And first, I'd like to introduce Dr. Dan Cooper, Associate Vice Chancellor for Clinical and Translational Science. He runs our Institute for Clinical Translational Science. He's been active in the COVID-related clinical and translational research projects since the onset of the pandemic. Cooper leads regional and national studies focused on the use of convalescent plasma, and he's part of a national group of pediatric thought leaders who are focused on strategic planning to reopen our schools as safely as possible. Our next panelist is Pamela Kahn, who is the County Superintendent of Schools for the Orange County Department of Education. She is taking the lead in tracking the regulatory aspects of mandatory or required vaccination efforts. Kahn is a nurse, a public health expert, and the department's liaison to school nurses, who are required to report the number of parents requesting vaccination exemptions for their children, among other roles. And then we have Dr. Regina Chincio Kwong is here again, and she is still the Deputy Health Officer for the Orange County Healthcare Agency. And I introduced her before, so I will just welcome you back, Dr. CK. So let me jump right into a question for Dr. Cooper. The return of in-person learning comes amid this surge of the Delta variant. And with your background of working with other pediatric thought leaders, is now even the best time to return to in-person learning in Orange County?
So that's a very good question. Every parent and every teacher that I've talked to has addressed it. So I'll start with the answer. I wouldn't use the word best time, but I think it's something that we have to try to do. It would be disingenuous to say there is no danger and that you're going to send your children back to school, and there is absolutely no way that these kids will interact with each other. And those individuals, be they political or policymakers, that have pretended to try not to tell the truth to people have inevitably failed in their attempts to bring back the kids to school. So I think what we have done over the past year is understood that we have to weigh the damages of keeping kids out of school, which are real and impact health, both mental health and physical health, with the impact of the fact that there will be kids who are going to get this disease in school. And it would be lying to parents and the public to say otherwise. But I think that the community of pediatricians and parents, and looking across the globe, it's really clear that the damage that has been done by keeping kids out of school to the children themselves is really substantial, and that trying to keep the schools open as healthily as we possibly can and now is really what we should be doing.
Dr. CK, I'm listening to Dan, and I'm wondering if the family has someone at home who's at significant risk, does it change how we think about that particular student going to school or how we behave?
No, I think in general, just like Dr. Cooper said, I think we all really owe it to our kids to have that in-person learning. There's when kids go to school, they're really there to learn the social skills, and you lose that when you're on Zooms all day. And I mean, yes, if I were that family member who had someone who's high risk at home and I had a child going to school, I would make every effort to make sure my child took every precaution when they got back in the classroom, right? And I would also ask the school, what are you doing to keep my child safe? But realize, yes, there might be a small risk, but hopefully if the child is following all the recommendations, or if they're eligible for a vaccine, that's even better. They can get vaccinated, but still use precaution. I mean, that's the best case scenario. Our kids really took a huge hit over the last 18 months by not being in school.
Okay.
Could I just, if I may,
sure.
Just add to what Dr. CK said. Just because you keep your kid at home doesn't mean that you're going to avoid any contact with a family member at home from a pandemic virus. The kids, unless you keep them in a closet locked up, they are going to be out in the real world. And the great advantage of school, and Dr. CK really nailed it when she said socialization. What the kids are learning is how to operate in society during a pandemic. The kids at school really learn the importance of face covering. They really learn the importance of hand washing. I'm sure Pam can comment on that. In my clinic, every kid that I talk to wants to go back to school. They don't mind wearing masks. They want to be good citizens. And in many ways, that actually will protect that family member, because those kids now understand not only how they're supposed to act at school, but when they go to the supermarket and when they go to the park and when they see their friends. We've just seen that over and over again.
That makes a lot of sense. So Pam, so you're so heavily involved in the school reopenings. What would you say is worrying the parents most about sending the kids back?
Good question, Steve. And first of all, I want to say I'm here representing Dr. El Maharis, who is the County Superintendent of Schools. He had a conflict that he desperately wanted to come, but I was lucky enough to be able to stand in his place.
Well, and lucky for us too. It's great to have.
Thank you. And as to your question, obviously, I think there are two things that parents are very concerned about, and paramount is, of course, the safety of their children and subsequently their families, whether they have high-risk individuals in their families or not. And I think the second concern that they have with their children is the disruption in their education, given the quarantines and isolation requirements, et cetera. So even though we're back in school, which is, in medicine, we always weigh the risk versus the benefits on interventions. And clearly, given what Dan Cooper referenced as to the difficulties faced by children, both socially, emotionally, and educationally, being back at school is a benefit that far outweighs the risk of being in school. We know that transmission rates in school are very low, and I would like to thank Dr. Cooper and the healthcare agency, Dr. CK and CHOC, for working with the schools, doing research that has helped prove this in addition to all the research that's out there, and creating guidelines for us on how to manage cases in the school. We have a symptom tree that goes out to every school that helps them. It's like a flow chart that guides for if you're vaccinated, unvaccinated, masked, et cetera. So we are addressing both the safety concerns in that aspect, and we also have guidelines for what we call modified quarantine if a child is eligible, that keeps them in school while still practicing social distancing, masking, et cetera, to prevent the transmission of virus.
Thank you. Let me remind the audience that if you have questions, please put them into the comments, I guess it's called, and we'll be able to pass them on to the experts. Let me just ask a general question, and each of you maybe take your response to it. I'm a parent. What are you telling me about sending my kids back to school? We can start with Pam.
Okay, well, first of all, what we want everyone to understand is that parents play a vital role in the community in keeping their children healthy, children's friends healthy, staff at school healthy, and we really need to unite to keep our children who are unvaccinated at this point, for the most part, healthy. So they play a pivotal role. And the way that they can do that, and what we're asking you in the schools, is clearly masking. First of all, California does have a mask mandate. This is not a district or a school decision, and I hope parents understand that. You know, there's a lot of difficulty around the country. We hear about masking controversies. I was just on a call with superintendents this morning, and fortunately, we're not seeing a lot of that in Orange County. There is some, but there hasn't been a lot, so we're grateful for that. But we want parents to understand there is a mask mandate that districts have to follow. We don't have any leeway. We also want to let you know that the masking, even with the Delta variant, it can't evade physics. It doesn't have any more opportunity. It doesn't do any better at getting through masks than any of the other variants do. So please relax about that. In the schools, we practice physical distancing. We do 3 feet now instead of 6 feet, which the CDC has approved. Particularly when you mask, that seems to be very effective. We want you to assess your child every morning before they go to school. There's a physical symptom tracker that your district may provide, monitor their temperature, their symptoms, cough, fever, runny nose, body aches, certainly loss of smell and taste, which we don't see often in children. And don't send your kid to school when you think they may be ill, and please get them tested. Once they're at school, we are practicing, as I said, the social distancing. We do the great hand washing. The kids are learning that. And a thing that parents need to think about too is please make sure that your transportation for your kids going back and forth to school is safe. We mandate masks on school buses.
Whoop. Pam's frozen
In class all the other time.
You froze for just a moment, but I think we got your statement in full.
Okay.
Dan, I'm a nervous parent coming to you in your office. Tell me.
I think it's very important to also let parents know that if they are, after our discussion, if they're still anxious, they don't have to send their kid to school. We would like them to. We think school is the healthiest place for the child to be. But I have found in the occasional discussion that I've had with those parents to suggest that, we're going to chain you to a school bus and make your kid go to school. That's not going to happen. Now, we don't have distance learning right now. So the ability that the school will prepare, and Pam, please correct me if I'm wrong, but the school will prepare a lesson plans for the child, but it's not even a distance learning on the way it was for last year.
Okay.
I would say to the anxious parent a couple things. One, regionally, Pam referred to the fact that I am just really so proud to be in Orange County, where we have developed ongoing coalitions between the Public Health Agency, Dr. CK's group, OCHCA, the Orange County Department of Education, University of California at Irvine, Chalk Children's Hospital, and the schools. And we have had discussions at length about the algorithm, for example, that Pam referred to. Now, why should a parent feel good about that? Because we are sharing knowledge, information, and best practices among these different groups. And we don't have all the answers. I would make this very clear to a parent, but we have the best possible information that's out there from these various sources. And that should help the parent understand that whatever decisions we make, they were made collectively and in a true coalition. So that's something. Again, repeating the fact that, keeping your kid out of school is not a guarantee.
Right.
That child will not be affected. This is a pandemic. This virus is out there. And as I said before, the school may be safer because the kids really are learning about how to manage things like face covering, physical distancing, and hand washing.
Dr. CK, anything to add to those comments?
I'm just adding the same thing that everybody else was saying, that yes, as long as the children are wearing their mask indoors and even outdoors, especially if they can't maintain that distance, that should be adequate. And just like what was mentioned, this virus is in the community. A lot of the spread is actually happening outside of schools. And we learned that in previous surges, not that that's not true currently, but it usually happens with small gatherings and people are not, minding and using their mask or distancing, or it's happening at a grocery store, right? Where not everybody is masking and you've got common surfaces that are not sanitized. So I think we all have to learn how to live with this virus because it's here to stay. And the best case right now is for our kids and even adults to learn how to deal with it at work and at home and at school. I also want to mention that the mask mandate applies to both public schools as well as private schools, because I know that there's a lot of questions about that, and we're getting a lot of concerned parents asking, and even showing us pictures of locations that are not masking indoors. I have to say, everyone, all K through 12 here in Orange County, private, charter, I don't care what you are required to have universal masking for staff and students.
Steve, if I could add something, because what Dr. CK said is so important. There is this sense out there that there's something very damaging about having a child wear a mask. And we really need to address this. And people will say, well, there's no definitive data that shows that the mask prevents this virus. And it's true. We can't take 50 kids, divide them into two groups of 25, put masks on half, spray virus on them and see what happens. We're not going to do that study. It's not going to be done. So that the data that we have is based on not the best possible data, but it all points to the safety, to the ability of the mask to prevent the disease. And I use this with parents sometimes. I say, well, sometimes maybe somebody actually does that study and they discover that masks don't really make a difference. So what's the remedy? You don't wear a mask. And the data that suggests that masks are harmful to children is just not there. It's not there. It's not as if to prevent this virus, we're suggesting that people put pins in their brain or something like that. We're just asking them to wear a mask. Every kid in my clinic, this is purely anecdotal, okay? Every kid that I talk to has no problem wearing a mask, even younger kids. And then they say, well, you're gonna take these kindergartners. Nobody's gonna strap a kindergartner down on a table and make them wear a mask when they're feeling uncomfortable. But this notion that somehow wearing face masks for children is damaging for life is really patently absurd. And this is something we need to express to parents as well.
So the next question I have, I feel like some of the themes that you've raised are going to come back up in the next questions that are being raised. I'll direct this one first to Pam. What would you recommend adult educators and staff members do to protect themselves with unvaccinated children in their charge?
Well, obviously, the first recommendation is to be vaccinated. Get your vaccination. In the state of California now, all educational staff, whether it be teachers, custodians, front office workers, are required to either be vaccinated or have a weekly test by October, I think it's the 1st. So, we encourage you to get your vaccine. And we've had, as Dr. Cooper was just referencing, one of the schools in Santa Ana, I believe, is up to 94% of their staff vaccinated. About a week or two ago, I heard generally that 70 to 75% of all of our school staff, which includes, as I say, teachers and all other workers employed by educational institutions, K through 12, have been vaccinated. So hopefully, we can keep upping that ante a bit and having more and more vaccinated. That's the primary move an adult can take to protect themselves against our children who are not vaccinated. Secondly, keep your physical distance in the classroom. Wear your mask religiously. And as Dr. CK said, for a while, the recommendation was you didn't have to wear it outdoors, but as Delta is rearing its head and we're in this surge, not a bad idea to wear it outside as well. It doesn't hurt anything. We're used to it. Let's do it. Encourage your children to have good hygiene that you keep dealing with in the classroom and or in offices. Hand washing, hand sanitizers available, and make sure they wear their masks too. So the same things that we ask of our children, other than vaccinations, because they can't yet, we ask of our adults. If we all follow that religiously, I think that we would have pretty good outcomes. And as Dr. Cooper's research has found, we do have good outcomes in the schools. We don't have a lot of transmission. So adults are pretty safe, but it doesn't hurt to take that extra bit of caution with the masks, distancing, hand washing, et cetera.
Thank you. Dr. CK, we touched on this a little in the first session, but I'm going to bring it back in the context of school. How many children in Orange County, more or less, do we have who are under 12? And what are we trying to do to protect the low-income communities who are being hit the hardest with the disease?
So we have about 456,000 in our community who are under the age of 12, so they're not yet eligible for the vaccine. And these are school-age children, so they're going to our schools, and basically we're working with our CBOs to get that message out, to educate on appropriate hygiene, and to get all the family members and the staff at the school to get vaccinated so that we can at least protect that child in other ways. That's what we're doing.
Okay. Dan, I'm sorry that I keep asking the same types of questions, but they're what come forward in people's concern. What is the risk of transmission of Delta within a school compared to the original, and how does that make us think about what's in front of us?
Well, the data are just starting to come in, Steve. I mean, if you look around the world, there's only a few schools that have been opened where they have enough data. So the risk of transmission is likely higher because the Delta, the variant itself, has a higher risk of transmission. So again, I think we have to tell people the truth. It's probably going to be higher. On the other hand, I would say that in the past year and a half, the schools have really come to improve their ability to do the mitigation procedures, the masking, the hand washing, the physical distancing. Pam referred to this earlier. I was speaking this morning with one of our fantastic principals in Santa Ana. And when she went through with me the steps that she has taken in her school, the education that she has done with not just her staff, but with the parents. And this is a school in Santa Ana, largely Hispanic population, who see the school as one of the great places. They love the schools. I was just so impressed that the ability of the school to implement the mitigation procedures has improved itself. So while the Delta variant is worse and more transmissible, the schools, by and large, throughout Orange County have gotten better. And a shout out to Dr. CK and OCHCA. They've been in the midst of working with the schools and and OCDE. And so we're all better at dealing with this. Again, we would be lying if we said to parents, there's zero risk.
Right.
There is risk. There is this virus, but we're better at handling it.
So here's a question that's come in. Our school district does not require kids to wear masks outside when they're playing together. But we know that the kids play in close proximity within breathing distance to each other. At what point will this be changed?
Right now, it's an optional recommendation, and that was put out by the CDC as well as CDPH. And again, I think when you're outdoors, there's just better ventilation in general. And if we just tell people, if you're able to keep your distance, it should be okay. Usually, if you just keep arms width distance from everybody, you should be okay. But, yeah, once you get closer, this is where everybody needs to just give each other space or wear a mask. I'm hoping the kids will, as they learn more about this illness too, they'll probably come up with their own, they may come up with, hey, it's probably safer if we wear our masks. I know my sons, they actually wear their masks outdoors now. I don't know, maybe their friends can actually tell me, they're probably telling you that right now because you're the mom, but maybe they're not outdoors, but I can tell you that they've been telling me that they've been wearing their mask outdoors. It's not a problem.
Okay, but so right now Orange County is following the CDC, and this is the CDC recommendation.
CDC and CDPH are all saying it's an optional to wear your mask outdoors, and we're following both.
This allows me to address something that I'm, my own area of interest in, exercise and physical activity, and how we deal with this. So 2 points. There are now increasing data showing that the other pandemic, the obesity and physical inactivity, has become worse in the past year and a half. We're seeing there's a couple of papers now that demonstrate inordinate weight gain among kids, predominantly among lower socioeconomic kids. People don't realize that in Orange County, Santa Ana has the lowest percentage ratio of parks per population of almost any large city in the United States. So there are not many opportunities for these kids to be physically active in their neighborhoods, and school is the one place to do it. We have demonstrated that you can have very creative and really fun PE with social distancing. That can happen. With other sports like football, it's going to be more difficult, but it is an area of research that we really need to pursue quickly so that we can provide the schools with better guidelines about how to use masks during physical activity. Right now, it is optional. We would recommend that if you're doing physical activity where the kids can be physically distanced, that they should probably try to wear their masks. There should be a lot of masks around because as they sweat and everything like that, we need new masks. But we don't have solid guidelines yet about this.
So speaking about your experience, long experience as an exercise physiologist, do you have a comment on why children seem to be more resilient than adults when infected with the virus?
Well, I'd love to say because they're more physically active than adults, but I can't prove that. We do know that obesity across adults and children is one of the tremendous risk factors for morbidity and mortality if you get the disease. And it's not just true, by the way, for COVID, it's also true for influenza as well. So there is something about the effect of being fit on your immune system, which really helps you get through all of these issues as well. In our study that Pam referred to, it was one of the first studies where we actually we were able to get blood samples from 320 kids throughout Orange County, and we did find very good T cell and immune responses in children. This was a question that had been out there, other than that, for me to say, I know why children seem to have less severe symptoms. I don't know the exact biological mechanism. I am very grateful to whatever we believe in in the heavens above, that children have not been so severely affected. I mean, can you imagine what it would have been like if our hospitals were full of very, very sick children? It's bad enough that it was the elderly, but we have been spared the agony of having many, many kids severely affected. Again, for the ones that are, it's terrible. There's no question about it. But fortunately, it's been a minority of kids, and it remains that that's the case.
Here's a slightly different question, but Dr. CK, maybe you can address it. We have the question is, we have a little over 200,000 children in Orange County under the age of 5. How can we support and share this type of information with child care providers? Is that part of something that the health department is thinking about? Are any of you aware of reaching out to healthcare, child care providers, or is that?
That's a great point. I think we should have that discussion. This whole time we've been focused more on K through 12, but that's a great idea. I'll bring it back to our vaccine task force and make sure we have educators there at the, with the different childcare industry leaders. So thank you for bringing that comment up.
Great.
Can I just add something to that, because this is really important? It brings up the issue, of course, of the younger kids is that they're not going to wear their masks the way other kids are, and that it is any decent provider for these younger kids. They're not going to be as physically distant. It's just not their nature. The kid's going to fall down and stub his or her toe, and that the good provider is going to be there hugging the kid. So that we need to pay special attention, as Dr. CK pointed out, for these. And the other group is the kids with special needs who are going to public school. Those kids, the idea of physical distancing doesn't work. A Down syndrome child, a child with autism, the provider to be effective needs to be there. And we have to provide those providers with additional and the best protective equipment that they can possibly have. And we know it works. I mean, Steve, we know in our own hospital that, you know, the frontline nurses and doctors who take care of known patients, if they wear their protective equipment well, don't get infected.
Right, right.
So I think, you know, we just have to, and I will tell an anecdote. One of my patients is a 3-year-old with very severe autism who's nonverbal. And his mom was telling me that when he didn't go to daycare, his behavior was just became terrible. All of the self-destructive, self-biting, et cetera. And again, a nonverbal kid. But when he went to daycare, he came home happy. He was manageable. He could go, he went to sleep on time, he ate on time. So there is this profound effect of socialization, even at a younger age, and even in a child with something like severe autism.
Right. Pam, this is related to something you already said, but the question has come up differently. Are there new protocols that have been implemented in the schools because of the Delta? Or is it an expansion of the protocols that you already have been putting in place? And maybe you can reiterate some of those.
Yeah, that's an excellent question. And I'm glad I have another chance to speak because I wanted to let everyone know that there is a website that is for parents and school administrators. If they just Google Safe Schools Hub, so SAFE, it's all one word, SAFE, SCHOOLS-HUB, Safe Schools Hub. A CDPH, California Department of Public Health site comes up, has a section for parents, section for schools, has an FAQs, et cetera. So people can keep track of the changing guidance that does occur, that we get frequently from the CDPH on that site. So as far as being particularly responsive to the Delta variant, I couldn't speak to that. I think just as our knowledge grows about the COVID virus on the whole and the mitigation measures that work better, and as vaccines change and become available, I think that our strategies have evolved just into the virus as a whole, not specifically to the Delta, because as I pointed out earlier, you know, if we use the masking and the vaccines, et cetera, the Delta is not able to get a hold any more than with any other variant. So just, I think just our basic knowledge as time goes along is what dictates the change in the protocols that we follow in the school. Having said that, yes, we get changes in protocols almost weekly. It's just constantly something is tweaked or changed or upgraded. So it's a lot to follow, and I encourage parents to get on and educate themselves on that website as well.
Well, I want to just add a comment that reflects a few of the different collaborations that we've all been describing here, between the schools, between Orange County Health, between the universities, between the hospitals. I want to laud you all for this work because it's really critical, and there are paths that were existing but not necessarily very well worn, and you've really just grabbed them and made them so. And I'm saying this as a prelude to the fact that I was talking to the Deputy Secretary of HHS yesterday, who said and explicitly thanked us as a university and because they understood how tightly Orange County was working between academia, the school system, and the health department. And they were seeing it in DC and reflecting back how impressed they were with what was happening here. So I think that speaks to the strength of Orange County. Our businesses, our communities, and our organizations really have a way of coming together that I think is very impressive, and we should be proud of.
Steve, it's great that people recognize this, and I just wanted to comment on what Pam was saying about the changes in guidelines. So these are perceived in two ways by people. One is they go, you guys don't know what you're talking about. You're constantly changing your guidelines. It's ridiculous. I would urge us to, and especially the audience, to realize that what really that means is that we are learning as we go along. We don't know everything about coronavirus yet, about COVID-19, and we don't really know about everything that we need to know about the Delta or other variants. And, you know, our attitudes towards schools opening and closing may change as we get information. We are expecting, unfortunately, that there probably will be a seasonal uptick in the virus in November and December. And we're just going to have to keep a close eye. And what I would say to everybody is the fact that we've got this coalition, that we're really watching this carefully, that we're digesting the information. If policies change, it's not because we're disingenuous or mendacious. It's because we are going to be responsive to the data. We hope that we're going to show that the schools are as safe as they could possibly be, that we keep our fingers crossed, but we're not going to lie about this, and we're going to keep, you know, our policies and the public in line with what we learn. And I think it's really important to let everybody know that.
Transparency and open communication is really the best, as they say in many venues, the best disinfectant is light. We've reached the end of the questions coming from the audience, and the questions that I had prepared. Would any of you like to add anything at this point in summary, or to offset concerns that you have about communicating to the community about school opening or the virus?
Well, one thing, if I may, that I think is really, really important is there has been an unfortunate amount of politicization of things like face mask mandates and what we're doing with kids. And Dr. CK made allusion correctly to people feel that we're stepping all over individual rights. And I would like us all to take a deep breath and just think that keeping the kids at school is probably one of the best things we can do for society in general right now. Having educated, happy, socialized children is probably a great thing for our country and for the democracy that we have as we move forward. And, you know, I would just like all the parents and everybody take a deep breath. We should avoid statements that putting a mask on a kid is child abuse. I've heard that out there, and that's just a lie, and it is not right. And the other side of the coin is the parents who are concerned, and they legitimately should be concerned, is to not express to another parent that if you allow or think that your child should not be masked, that you're killing another child. And I've heard that, and we've got to avoid those extreme kind of thoughts. We've got to work together in this sort of learning system to make sure that we keep.
Dr. Cooper, you sound like a pediatrician.
I'll show you, it's on my wall there, that certification.
Well, I want to thank the expert panelists. I want to thank the audience for joining us. I'd like to thank UCI and UCI Health for sponsoring, and I'd like to thank the Orange County Forum for hosting this discussion. It was our pleasure to be here. Thank you all.